If you look at what it fundamentally does, Transcendental meditation, this is a study done with subjects with high blood cholesterol. It's a 1-year study looking at people who practiced TM for that year. And it was associated with a significant reduction in total cholesterol by about 10%. That's 30 millimeters of cholesterol. Now, if you're on a medication for cholesterol, we hope you can get 30 millimeters lower in your blood cholesterol. But this happened through transcendental meditation alone. Cholesterol is the first big risk factor we talk about with heart disease. The second big risk factor, this is a randomized clinical trial finding improvement in the levels of insulin resistance, glucose, even insulin levels themselves in over 100 people who had coronary blockages after just 4 months, 16 weeks of TM practice. Dramatic changes reflected that were significantly greater than just teaching people about their health. That's the second part of the problem we have with heart disease, which is diabetes. The third big one, but this one, by the way, was funded by the NIH. So it's a reputable organization supporting this work. The next study looked at a randomized trial of hypertension sufferers, people with high blood pressure, showing that transcendental meditation produced significant reductions in systolic and diastolic, the high number and the low number of the blood pressure, of 11 and 6 millimeters respectively. Those are big numbers. We don't get that kind of result all the time with medications. Now, those three things, high cholesterol, high blood pressure, and high blood sugar, those three things drive heart disease. And this last image is probably, for me, the most important. This is an image looking at transcendental meditation effects on reducing mortality, heart disease, and stroke. By how much? By 47%. It was a long-term randomized trial in older African-American patients with coronary disease. This kind of a stunning impact, unimaginable in the transcendental meditation group. And when you talk about all causes of death, and you can reduce them by that much, as well as non-fatal strokes and non-fatal heart attacks, these are spectacularly large impacts.